Welcome to this training on how to set up a vaccine clinic. This was an introduction into planning out your vaccination clinic. Next slide, please. So as you know, there are many logistical considerations when you set up a vaccination clinic, including matters like vaccine storage, handling, administration, and documentation. And so we in DMOSH Public Health thought that it would be a good idea to put this training together that just gives you the basics of how to set up a vaccination clinic in the context of any vaccination campaign. This includes influenza, includes COVID, and it even includes your routine vaccination campaign that you might have. So just feel free to use this training to guide you through any vaccination campaign that you need to conduct. Next slide, please. So for the presentation outline, my colleague Jamie will be going through a checklist of all items that you need to consider when you set up the vaccination clinic. And then we will end with a number of resources that will be useful to you and your staff as you think through this topic. Over to you, Jamie. Thank you.
Thank you, Esther. So again, we're going to be talking about immunization, starting, any immunization clinic that you might be preparing. And it starts with receiving the vaccines to your clinic. So we have the shipment and transport of vaccines. The vaccines should be shipped directly to the facility and clinic as possible. This ensures that there's no breaks in the cold chain integrity. The temperature is better monitored. The shorter the distance, the less room for error. You want to make sure that all staff that are involved in transport are aware of the manufacturer's guidelines. This is also important for all staff because if someone who normally receives inventory is not there that day, you want to make sure that the person who is receiving the inventory is aware of the guidelines and what they should be looking for, so they can address any areas to make sure that that vaccine is still viable to be given. We really want to avoid any opportunity for vaccine waste. The vaccine should be transported, again, according to the manufacturer's guidelines, and it's important everyone understands what those guidelines are. So again, if you're ordering vaccine, you can prepare when questions are asked, okay, well, I need it to go from A to B is better than A to C, so we get the vaccine more directly. And the temperature should be monitored, again, per manufacturer guidelines. Each vaccine will have their own temperature requirements, and it's important that you know which requirements apply to which vaccine you're given. So now to moving on to the arrival of the vaccine to your clinic or facility. You want to ensure that the vaccine shipment arrives within the appropriate time frame and in good condition. So again, it's looking at that check to make sure that if the vaccine is, it's not late, it's not sitting in an airport, it hasn't been sitting in the sun, and if it has, that these issues are addressed promptly, again, to make sure that there's no wastage of vaccine and also that the vaccine that's given hasn't exceeded the necessary temperature requirements or, if applicable, light requirements. If a cold chain monitor is included, you want to make sure that there's no indication of a temperature excursion, the temperature hasn't increased during transport. So for example, if it's in a refrigerated truck, you want to make sure that there's a monitor in there that for whatever reason wasn't refrigerated for a period of time, and then you got the vaccine cold, but there was no breaks from point A to point B when the vaccine reached your clinic. Upon arrival, the vaccine should be immediately unpacked and stored appropriately. So, some supplies get delivered to a clinic and they may be able to sit there for a moment, things that aren't as sensitive to light and heat, but with vaccines, they should be immediately unpacked and stored in the appropriate place. Vaccines should remain within manufacturer temperature range, and we've said this, a couple of times, but then I guess the temperature range is very important with vaccine to make sure that they're effective once they're in someone's arm or leg or wherever they're given, and then also protected for light. And again, this applies to not all vaccines, but some vaccines. And again, it's going to vary by manufacturer. Even the type of vaccine might matter. So you might have an influenza vaccine that has different requirements depending on the manufacturer, a COVID vaccine that has different requirements depending on the manufacturer. You also want to check expiration dates of the vaccine, but also of any of supplies. You want to check the expiration date of needles, of alcohol swabs, of any other supplies that you receive with the vaccine. In regards to clinic preparation, you want to put a contingency plan in place in the event vaccines need to be replaced. So I think it's helpful to work through some of those what if scenarios. What if the vaccine doesn't arrive? Where are the points? What can we do to prevent any kind of breaks in that supply chain or breaks in the logistics? I think it's sometimes helpful to think through those things so you can put measures into place in the event there are any hiccups on the way to arrival. You want to have emergency medical kit, including epinephrine and equipment for maintaining an airway. These are, you want to make sure it can be an auto injector, it could be a pre-filled syringe, but you want to make sure you have all of your medical supplies on hand and that everyone involved in giving administrations knows where these supplies are and knows how to use them. You might have staff that come in to assist with immunizations, especially when you have large numbers of patients that needing immunizations. I'm thinking, you have your routine vaccine clinics where people kind of trickle in for routine immunizations, but in times of COVID or during flu epidemics or potential any other where there's a very quick need for vaccine or people, there's a larger surge, you might have staff that come in to assist, and you just want to make sure that all staff, especially if it's staff that may not have, administer vaccines regularly, know where the emergency medical supplies are, how to check the expiration dates, and how to use that equipment. You don't want to reach a situation where you have an emergency and you have someone who doesn't know what the equipment is or how to use it, or just is less familiar with the maybe updated equipment. All vaccination providers should be trained in CPR, should be familiar with the signs and symptoms of anaphylaxis, and know the location of emergency medical supplies. Walking through some scenarios can be helpful during a staff meeting with your staff to make sure all staff have the opportunity to ask questions. What are the signs and symptoms of anaphylaxis? What would happen if a patient presented with X, Y, or Z? You want to designate an area for the management of emergencies. So again, if you might have to deal with an emergency right where at the point of care where the patient is, depending on the emergency. But I think it also can be helpful to have an area within your clinic where if there's an emergency, we can bring someone to this area that's a little bit more private. I think sometimes you want to really avoid crowding of a patient if there's any kind of emergency. It could just increase anxiety for both the patient and for the healthcare workers. So there's an opportunity to create, a designated, more private area. And also it allows for, if there's someone who's coming to assist with help with an emergency from another location, they know exactly where to meet the other staff. And then you also want to designate a qualified individual to oversee infection control. And this could be someone, it doesn't have to be a separate person. It could be someone who's involved in the clinic. It could be the manager. It could be the, head nurse or manager for that day. But you want to make sure that they're trained and well knowledgeable in infection control, and to make sure that things are being cleaned, things are being, needles are disposed of properly. Someone who's just designated to oversee the infection control processes. We really want to, the goal of vaccination clinics is to, reduce the burden of infectious diseases. And we want to make sure that we're doing all we can from an infection control perspective as well. In regards to clinic documentation, you want to record vaccinations in the appropriate clinical reporting system. So in the UN, this is EarthMed. You want to make sure that all vaccinations are documented. If the patient needs documentation, they're provided that as well. And you want to ensure that you maintain records of which staff are on site and handling vaccinations. In the event of a vaccine administration error, you have a record of who was on site, who was at the vaccine clinic, and you can look back and see everyone who was there that day and when they were there. I think it helps for good reporting and, is an easy, and you might already have certain protocols in place of staff in and sign out, but it's important to keep these records, and it should include the shift time, the clinic location, and the date. In regards to supplies, you want to have infection control supplies. This requires hand hygiene supplies. That could be soap and water. That could be Purell. You want to make sure you have enough for both staff and for patients who are coming into the clinic. You want adhesive bandage strips to put over after following immunization. Individually packed sterile alcohol wipes if available, but just to be able to have alcohol to clean the site. You want to have a sufficient number of sterile needles and syringes. I have an example over there of the ones that automatic lock, but however, those might not be available in all places. And you definitely want to have a biohazard sharps container. And again, this is so we can safely dispose of the needles and avoid needle stick injuries. Additional supplies are needles in a variety of lengths. So this depends on the vaccine you're given, if it's sub-Q, if it's intramuscular, if you're giving to adults and children, only adults. To make sure you have different needle sizes available. Privacy screens are great to have. They're not always available, again, depending on the supplies that are available to you in your clinic, but privacy screens just give the patient a little bit more privacy. It makes them feel more comfortable and allows them to maybe ask more, feel more comfortable to ask questions. And then especially if someone has to lift their shirt, it provides that privacy when getting a vaccination. You want to have screening forms and patient education materials, screening forms to see if there's any potential contraindications to the particular vaccine that you're given, and then also patient education materials specific to the vaccines that you're giving to make sure the patient is well informed to the vaccine they're getting, to the purpose they're getting the vaccine, to any potential reactions they may have. And then also make sure you have supplies to clean your vaccination area. So to make sure that everything is always, kept clean, not only at the beginning and the end of the shift, but, throughout the shift as well. So the following equipment is medications and supplies for assessing and managing anaphylaxis. And this is for any vaccine clinic. You want to make sure you have epinephrine, a pre-filled syringe, or an auto-injector, depending on your clinic and what's available to you. You want to have H1 antihistamines, such as Benadryl, available. You want to have a blood pressure cuff, a stethoscope, and a clock or watch, something to assess the pulse. These are at the bare minimum. You want to have these on site. You want to make sure that they are not expired, and you want to make sure that they're easily available. They're not in a locked cabinet. They're on site, they're not too far away, so anyone can access these materials in the event of emergency. Especially with anaphylaxis, time is really important. So you want to make sure there's not, they're not locked behind a cabinet and only one person has the key. You want to make sure that if they are locked, everyone knows how to access the drawer. Or if they're in an area where everyone say they're behind a door with a code, everybody is well aware of the code, all staff on site, so you can quickly access the materials. Or if they're in an emergency bag, everyone knows where they are in an emergency bag. Some of the larger emergency bags can kind of, be very packed with equipment. So it's very important that, staff know where everything is and things are labeled. Also, if available, you want to have a pulse oximeter to measure the oxygen, an oxygen delivery device, a nasal cannula, a face mask, bronchodilators, H2 antihistamines, IV fluids, an intubation kit, and a pocket mask for the use of CPR. So in regards to storage and handling of vaccines at clinic and facilities, this is very important, the storage and handling of vaccines, because while getting the vaccine to your clinic, the temperature is important. It's also important when storing the vaccine. Again, certain vaccines are very sensitive to light and to temperature changes, and so it's important to continually monitor to make sure that they don't go out of range. So you want to keep vaccines in proper storage equipment at the proper temperature range. You want to monitor the vaccine temperature during the clinic using a digital thermometer placed directly within the vaccines. So between 2 to 8 degrees Celsius or 36 to 40 degrees Fahrenheit for all refrigerated vaccines. Again, it's very important to look at the manufacturer guidelines, as guidelines may differ from vaccine to vaccine. So it's important to always check the guidelines, and it's important to check the guidelines before you receive the vaccine, so you have the supplies and equipment on hand as soon as you receive them, so there's not a rush of vaccine and you have more vaccine, or you don't have the proper supplies to appropriately store them. You want to review and document the temperature at least twice per day. And you also want to check the temperature, preferably at the beginning and the end of an 8-hour shift. So I know some clinics that do twice a day and do a manual log. I've seen electronic thermometers that report to a computer. I've seen at certain facilities 4 times a day. But you just want to make sure that everyone on site, someone is designated to check the temperature. It's checked daily or it's checked multiple times per day, at least twice, and then it's also recorded. If the vaccines cannot be stored in a storage unit at the site, so say you're bringing vaccines to another location, you just want to make sure the equipment you're using is appropriate, again, per the manufacturer guidelines. It can maintain the temperature needed to keep the vaccine viable, and that there's a temperature monitoring device, so you can keep monitoring the vaccines as they travel. And then also protecting the vaccines from light, again, if applicable, depending on the vaccine. So in regards to vaccine administration, there's a great UN vaccination skills checklist for the individual healthcare worker. This is a great document. It's applicable to any vaccine given. You can go through it yourself. You can go through it with a supervisor, and any areas, or a supervisor can go with it with, a new employee. They can go with it with all their employees before a vaccination clinic. It can be done yearly, whatever's appropriate to your clinic, but it allows you to go through and assess your skills with vaccination in each area. It allows the individual to ask questions and notice areas where there may need to be additional training, or there may be questions on how to do a skill, or things that have changed maybe, for someone who's been a healthcare worker for quite a long time. Sometimes things change, and I think this is a really good tool to use as a review before any vaccine clinic that's going to be held. And post-clinic actions, so you want to check the temperature of the remaining vaccine and record at the end of the clinic. You want to properly discard of any remaining vaccines. Any viable unused vaccine, you want to make sure it's in proper storage. And again, we're making sure that there's the least amount of vaccine wastage as possible. These vaccines, vaccines can often be expensive. They can be, hard to get, hard to transport. So we want to be really careful in making sure that we maintain the integrity of the vaccines that we have, to make sure that, they are effective once they get to the patient, and there's no wastage. You want to record any needle stick injuries in a Sharps injury log. I have an example here on the right, and report to all appropriate entities. So whatever the protocol is in your clinic, but you want to make sure that needle stick injuries are reported, and staff know how to report a needle stick injury and the next step in the process. You want to report any vaccination administration errors to your supervisor. Just make sure that they're recorded as well, and dispose all biohazardous materials properly. If you're using the biohazard Sharps containers, making sure that you have a plan to be able to deal with the waste. And if you're having a large clinic, again, in the event of COVID or a flu vaccine where you may have more people at one time than usual, you have a plan in place to appropriately store and dispose of the biohazardous material. And then just towards the end, we have resources. There's a lot of resources from NAISS, CDC, WHO available here that you can use when hosting a vaccination clinic. They're a great refresher. And I have some additional WHO guidance as well for when you help to prepare for your clinic. I really think that, preparing for your clinic, as much as you can do in the beginning to prepare and walk through different scenarios will allow you to have the most successful vaccination clinic possible, which is our goal. So thank you for attending today.